Do you know what it means to have an enlarged prostate? Well, let's delve into this common condition that affects an estimated 70% of men in their 60s. The prostate, a small gland located beneath the bladder and surrounding the urethra, plays a vital role in the male reproductive system. When this gland becomes enlarged, it's often a sign of aging and usually not a cause for alarm. However, it can cause some uncomfortable symptoms and, if not appropriately monitored, can lead to complications. An enlarged prostate doesn't always mean you'll experience symptoms, but when symptoms do occur, they can range from mild to severe and often have a significant impact on quality of life. Some of the common symptoms include difficulty starting urination, a feeling of incomplete emptying of the bladder, frequent urination especially at night, urinary urgency and hesitation, and urinary retention, which is the inability to pass urine. Despite these symptoms, it's important to remember that an enlarged prostate is not life-threatening, but complications can arise. You might find yourself getting urinary tract infections more frequently, or experiencing acute urinary retention, where the bladder becomes obstructed, making it impossible to pass urine. Other potential complications include bladder stones and kidney damage. So what can you do if you have an enlarged prostate? The first step is understanding the condition and its possible implications. The next step is taking proactive measures to manage the condition and prevent complications. And this brings us to the crux of our discussion, the 5 key pieces of advice for those with an enlarged prostate. These are not just tips, but essential steps that are crucial for managing the physical and emotional aspects of living with an enlarged prostate. To avoid complications, here are 5 key pieces of advice for those with an enlarged prostate. Stay tuned as we delve deeper into each of these steps in the upcoming scenes. And remember, knowledge is power when it comes to managing your health. Firstly, it's crucial to get evaluated by your doctor. An enlarged prostate is not just a symptom you can ignore or hope it'll go away on its own. It needs attention. And who better than a healthcare professional to guide you through this? Regular communication with your doctor is of utmost importance. This is not just about your physical well-being, but also your emotional well-being. Living with an enlarged prostate can be challenging, and it's perfectly okay to seek help. Don't hesitate to share your concerns, fears, or doubts with your doctor. Remember, your doctor is not just there to prescribe medicines. They are there to support you, to help you understand your condition, and to guide you through managing it. So, feel comfortable talking to them about anything related to your prostate health. But it's not just your doctor who should be in the loop. Your family members and even support groups can play a significant role in managing the physical and emotional aspects of living with an enlarged prostate. The journey becomes less daunting when you have people around you who understand what you're going through. Now let's talk about the evaluation process. This typically involves a medical history review, a physical examination, and laboratory tests such as a urine analysis. It's not just a one-time thing, but a continuous process that needs your proactive involvement. You should be scheduling routine checkups, not just when you feel something is off, but as a part of your regular health regimen. Your doctor will make recommendations for ongoing management and care, and it's crucial that you follow them diligently. This proactive approach is not just about managing an enlarged prostate. It's about preventing complications that could arise if left unchecked. These could include urinary tract infections, acute urinary retention, bladder stones, and even kidney damage. So don't underestimate the importance of regular evaluations and open communication. They are the first steps towards successfully managing an enlarged prostate and maintaining your overall health. Remember, your health is in your hands, and being proactive about scheduling routine checkups and following your doctor's recommendations is key. Secondly, considering a prostate cancer screening is essential. This is a key conversation to have with your doctor, one that could potentially save your life. Of course, not all men will need to undergo a screening, but it is something that should be on your radar if you're dealing with an enlarged prostate. Why is this so important? Well, prostate cancer is one of the most common types of cancer in men. It develops slowly, and initial symptoms can be similar to those of an enlarged prostate, making it difficult to detect early on without proper screening. However, if caught early, the chances of successful treatment are significantly higher. So what exactly does a prostate cancer screening entail? It often involves two key tests. The first is a prostate-specific antigen, or PSA, blood test. This test measures the level of PSA in your blood, a protein produced by both normal and malignant cells in the prostate. Elevated levels of PSA can indicate prostate cancer. The second test is a digital rectal examination, where a doctor checks the prostate for any irregularities in size, shape, or texture. The American Urological Association provides guidance on when these screenings should commence. They suggest offering a baseline prostate screening test to people between the ages of 45 to 50. However, they also recommend that screenings begin earlier for those at higher risk of developing prostate cancer. Factors that may increase risk include having African ancestry or a strong family history of prostate cancer. It's essential to have a frank and open discussion with your doctor about whether a prostate cancer screening is appropriate for you. Your doctor can provide personalized advice based on your specific circumstances, including your age, medical history, and risk factors. Remember, this is your health we're talking about. Don't be shy or hesitant to ask questions or express any concerns you may have. In conclusion, when dealing with an enlarged prostate, it's crucial not only to manage the condition, but also to be proactive in monitoring your overall prostate health. This includes considering a prostate cancer screening. Early detection is crucial in managing prostate health. Thirdly, it's vital to maintain a healthy lifestyle. A well-balanced diet, regular exercise, and good habits contribute to overall health, and this includes prostate health. Let's start with nutrition. Consuming a diet rich in fruits, vegetables, and lean proteins, while minimizing processed foods and sugars, can help maintain a healthy weight. Being overweight can put additional pressure on the bladder and prostate, exacerbating symptoms of an enlarged prostate. Regular exercise is another pillar of a healthy lifestyle. It not only helps maintain a healthy weight, but also improves cardiovascular health. Engaging in physical activities such as walking, swimming, or even gardening for at least 30 minutes a day can make a significant difference. Hydration is also crucial. Drinking plenty of water helps flush out the urinary system, reducing the risk of urinary tract infections, a common complication of an enlarged prostate. However, balancing your fluid intake and timing it right to avoid frequent nighttime bathroom visits is key. Next, let's talk about alcohol and caffeine. While enjoying a glass of wine or a cup of coffee in moderation is perfectly fine, excessive intake can irritate the bladder and prostate, leading to increased urinary frequency and urgency. Smoking, too, can exacerbate symptoms of an enlarged prostate. It's not just bad for your lungs, it can also cause bladder irritation and increase the risk of bladder cancer. If you're a smoker, consider seeking help to quit. Sleep is often overlooked but is an essential part of a healthy lifestyle. Adequate sleep helps the body repair and rejuvenate, contributing to overall well-being and better management of any health conditions, including an enlarged prostate. Lastly, stress management is vital. Chronic stress can have a negative impact on your overall health and can exacerbate symptoms of an enlarged prostate. Consider incorporating stress-reducing activities like meditation, yoga, or simply spending time in nature into your routine. In conclusion, maintaining a healthy lifestyle isn't just about managing an enlarged prostate, it's about improving your overall health and enjoying a higher quality of life. A healthy lifestyle can go a long way in managing prostate health. In conclusion, we've journeyed through a wealth of knowledge about managing an enlarged prostate. We've learned that an enlarged prostate is a common condition as men age, and it is not necessarily life-threatening. However, it does require attention and management to prevent any potential complications that could negatively impact one's quality of life. In this journey, we've discovered the importance of open communication with healthcare providers and the value of seeking support from family members or support groups. Remember, it is okay to ask for help or advice if you feel overwhelmed. A key part of managing an enlarged prostate is to get evaluated by your doctor. This evaluation usually involves a medical history, physical examination, and a urine analysis. Regular checkups and following your doctor's recommendations are essential to ensure ongoing care. We've also delved into the importance of considering a prostate cancer screening. While an enlarged prostate is not a direct indication of prostate cancer, it is beneficial to discuss the possibility of a screening with your doctor. The American Urological Association recommends offering a baseline prostate screening test to people between the ages of 45 to 50 years, and possibly earlier for men at increased risk of developing prostate cancer based on certain factors. Lastly, we've emphasized the significance of maintaining a healthy lifestyle. This not only assists in managing an enlarged prostate, but is also an important part of overall health and well-being. A healthy diet, regular exercise, and a balanced lifestyle can go a long way in managing the physical and emotional aspects of living with an enlarged prostate. Remember, each journey is unique, and it's important to tailor these pieces of advice to your own personal circumstances and needs. Taking charge of your health is empowering, and understanding your body is the first step in this process. Remember, knowledge is power when it comes to managing your prostate health.